Have you ever tried communicating or talking to someone, but the bad breath or the unpleasant odor you experience made you drew back? This is the Love Doctors channel. Please subscribe to our channel, like our videos, share, comment, so that we can bring you more health, education, and information around the globe. So we are going to look at places bad breath or halitosis originate from, the bacteria responsible for causing halitosis, and how to handle or care for bad breath. So I'll encourage you or entreat you to watch this video to the end. Halitosis or bad breath is a term used to describe noticeable unpleasant odor exhaled during breathing or talking. It gives a very bad impression or reputation of people, the most reason why most people seek for dental aid. Before I come to sulfur producing bacteria responsible for halitosis or bad breath, let's note that the mouth is exposed to less oxygen and it's also inactive during the night. So most at times, bad breath or odor normally worsen upon wakening, that is early in the morning. Bad breath intensity may differ during the day due to eating certain foods such as onion, garlic, meat, and other foods. Sometimes bad breath may disappear following brushing one's teeth or rinsing with mouthwash, but in chronic halitosis or bad breath, medical attention may be needed. Now, let's focus on places in the body where halitosis or bad breath originates from. Our first place of origination is the mouth. There are over 600 types of bacteria in the mouth, and they are in there to help proper digestion to take place. But if the mouth is not cared for properly, sulfur-producing bacteria may overgrow to produce high level of foul odor or to form plaque, causing bad breath. Our second place of halitosis is the tongue. The tongue is the most common place responsible for bad breath. So most sulfur-producing bacteria such as Streptococcus, Fusobacteria are mostly found at the back of the tongue or on the surface of the tongue. And so when the tongue is left dried or not properly cared for, it results into the overgrowth of these bacteria, producing a foul odor smell, causing bad breath. These bacteria also break down protein at a very high speed, producing odorous, volatile sulfur compounds which affect one's breath. The next place is the nose. The nose is the second common place of bad breath. When a person is suffering from sinus infection and is not treated properly, it results into bad breath. Our last place is the stomach. So the stomach is the uncommon place of bad breath. Bad breath results from the stomach when there is acid or bile reflux from the stomach. Now, before we come to how to manage bad breath, let's look at causes of halitosis or bad breath. Our first cause is poor oral hygiene. When a person does not brush his or her teeth properly, nor clean his tongue properly. Secondly, when there is improper treatment of nasal infections. Talking of dental factors, when there is infections in the teeth and is not treated properly. Dry mouth, some medications, medical conditions, and alcohol also encourages bad breath. Talking of smoking, smoking deprives the mouth of oxygen, and by so doing, it provides a conducive environment for bacteria to overgrow, causing bad breath. Lastly, let's take note that some food such as onion and garlic induces certain unpleasant odor in the mouth. Let's come to how people will be able to tell whether they have bad breath or not. Our first point is when you observe or realize that people usually absurdly draws a little back or away from you when you are talking or communicating with them, then you need to check your breath. After such absurd or weird experience with people, you can confide in family members or friends to tell you how your breath smell, because this is a very dicey situation that we don't take care. It will result into misunderstanding or miscommunication that can result into something else. There are situations that you can get a very bold friend who will be true to you and talk to you. In such situation, do not be mad at them, but rather check the smell of your breath and work towards it. Coming to the latter part, let's look at effective ways we can care for our breath and also control bad breath if you are experiencing such situations. Our first point is gently clean the surface and the backwards of your tongue twicely. This is one of the most effective way to control bad breath. You can do this by using your brush to remove any debris, any mucus, or any biofilm you find on the surface of your tongue. Dry mouth encourages bacterial buildup and worsen bad breath. And so, chewing gum can help your mouth produce saliva to reduce dryness, thereby helping to reduce bad breath. Maintaining proper oral hygiene. This can be done by cleaning or brushing your teeth twice daily, using mouthwash when necessary, and also visiting your dentist to remove rotten food debris from your teeth and also remove plaque formed in your mouth from time to time. Lastly, do not forget to drink water all the time to help maintain water level in your body so that your body will be able to produce enough saliva to keep your mouth moist. You are watching the Lab Doctors channel. Please kindly subscribe, hit the notification button, comment so that we can bring you more health education and information around the globe. Till we meet again,